The mHealth program in Rwanda we've learned a lot from this project. One, we learned that the surgical site infection rate for C-sections in this area was at 10 days out, was 11%, which matches the region. So that was not surprising, but it was a bit of a wake-up call. That's a whole lot more than it should be. We also discovered that antibiotics are prescribed a lot in the environment, pretty well for the preoperative dose that is recommended by surgical infection societies, by the WHO, and by the government of Rwanda, and a whole lot, often 2 or 3 antibiotics for a week-long course after the C-section, without an indication of a known infection, more as a prophylactic. We're going to look more into that, qualitative interviews with providers. The other thing that we discovered was WASH. Water, sanitation, hygiene are a major player in this postoperative surgical site infection story in ways that were kind of surprising to surgeons. Surgeons, we normally think that if you give a prophylactic dose and you cut right and you have sterile instruments and you have sterile drapes, your wound infection rates should be about as good as you're going to get. But it turned out that in addition to that, if a woman was there at the hospital during her 3 postoperative days, during any one of those days, there was a 24-hour period of no running water because of dry season. She had 2.6 times higher rate of surgical site infection than one who didn't. Even in Rwanda, that has a very robust community-based health insurance, 10% of the women undergoing C-section were facing financially catastrophic expenditures just from direct medical costs of the hospital time. Once you add on the direct non-medical costs, the transport back to the health center. Remember, all those women actually did a great job returning to the health center to get their C-sections wounds checked. That pushed us almost to 25% of women facing catastrophic expenditures. Going forward, one of the spaces that we're working in is with colleagues in artificial intelligence, specifically with machine learning. What if instead you put the diagnostic into the device? Take a photo and then runs it through an algorithm, lets the surgical community health worker then and there know high likelihood, low likelihood of surgical site infection.